Go now to Zimbabwe, where the government is backing the use of traditional medicine in the fight against COVID-19. This comes at a time when the country's health facilities are being stretched to the limit. The country's health minister and vice president have claimed that traditional herbs have proved to be an immediate solution to fight the virus. For more on this issue, we talk to Newzroom Africa's Xolisani Ncube. Xolisani, good evening and thanks for your time tonight. Traditional herbs, and this is something that's trusted by government. Do we know what's in these herbs?
Good evening, Wangi, and good evening to our viewers at home. Indeed, government says these herbs could at least help solve the current crisis because many people cannot afford to seek medical facilities because of the cost, as well as public hospitals are being overrun by the surge in COVID cases. Well, the question that you're posing is a very good question. I would say even those who are dealing with these herbs are saying there is need for people to be careful in terms of the dosage because we don't know the properties that are in these medicines, as well as how much one should consume, or else they risk to be infected by other ailments that would come with these these herbs.
And I wonder then, how are people reacting to, the news that they can use some of these herbs?
Well, Zimbabwe being an African country as well as an impoverished country for that matter, many people have already been using these herbs. You talk of zumbani, you talk of moringa, you talk of the eucalyptus as well as other medicines. You talk of lemons and others. They've been using them because they cannot afford to go to your hospitals because of the cost. So definitely, for them, it's like a plus. They're saying at least our government now accepts that we have to go back to our tradition. We have to go back to what we can afford. But the question is always, how safe are these medicines? That's what people have been asking for. And when government gives a nod to that, it gives like them a comfort to them, although it's not 100% comfort, but it's a comfort to say at least government believes and agrees that our basic can assist us to survive in the meantime.
And Xolisani, as you alluded to earlier on, that, hospitals have been inundated. The healthcare system is under serious strain from COVID-19. How is this issue, being addressed? Because we are still seeing some concerns around bed space shortages.
Well, what has been the problem is that government had put up hospitals to deal with COVID-19 specifically, and these hospitals do not have enough, ICU units, do not have enough trained nurses to handle COVID-19 patients, as well as medications, as well as PPEs for those nurses or doctors who are dealing with COVID-19 directly. And in the end, even hospitals that have been dealing with other common ailments, your malaria, your tuberculosis, your HIV and AIDS, and other ailments, your cancer, are now slowly, taking in COVID-19 patients. And in the end, the health workers who are handling these people end up being infected with COVID-19. And in the end, we see the number of people infected with COVID-19 cases going up, even health workers. So this has been a challenge, and the government says that it will soon be deploying more resources and also putting in place more hospitals to deal with the rising numbers of COVID cases. But in the meantime, it's a real risk for both the health workers as well as those people who would have been admitted in these hospitals but do not have COVID-19, and they are exposed to other patients who would have tested positive to COVID-19 but are not in wards specifically meant for COVID-19.
And Xolisani, this is coming also at the back of what we saw even last year, the strikes by the doctors, the healthcare professionals who were saying that, they want better working conditions. They want to be able to find themselves working in conducive spaces, and a healthcare system that was really not doing well, even from the beginning. I wonder then, if you've been able to speak to some healthcare workers, what are they telling you and what are they faced with in hospitals? Because I know that, like many other parts of the world, PPE continues to be a contentious issue.
Well, besides the PPEs, we are talking about the issue of salaries, definitely. Most health workers currently earn less than $200 US. That's your civil servants, and they are demoralized. I would say I've been talking to the nurses, I've been talking to the doctors, the junior doctors. They can't even afford to get treatment for themselves when they get ill with COVID-19. I'll give an example. For one to be treated with COVID-19 at a private hospital where they can get a ventilator, especially if you get, if your situation, gets worse, you need around $2,000 just as an admission fee. And most of these doctors can't afford such a fee. In the end, they are exposed and they die because they can't afford these hospitals. So in that situation, they are demoralized. They work for the sake of, because they sacrifice their lives to be doctors. They sacrifice their lives to be health workers. But in actual fact, they are not motivated. Besides that, they are also saying that there are no senders to talk of your medicines. There are very few medicines to tackle, other ailments, other diseases like your malaria and your HIV and AIDS, because the government does not have money. So in the process, they are working with the little they have at their exposure. They are stretched in terms of resources. Even themselves, they are drained and overwhelmed, I would say.
And Xolisani, of course, when you look at then the issues around oxygen shortages, we do have those problems here in South Africa as well. But is the government also looking into addressing some of those concerns, that side?
On Thursday, the minister of health, and as well as the COVID-19 task force, made a statement to the effect that indeed oxygen was also running short in terms of dealing with patients who need your ICU admission. But the government says they have availed around $7 billion to deal with the procurement of these, the oxygen and other essential medicines, as well as the recruitment of more nurses. But still, that money, according to the doctors, they say it's too short. It falls short of the requirement. They say that if you need to run a good health facility, it must have at least 15% of of our national budget. At the moment, we're dealing with around 8% of the national budget, which is a far cry of what is required or of what is needed in our hospitals.
Xolisani Ncube there, who is our correspondent in Zimbabwe. Thank you so much for your time, and certainly just giving us a sense of what government is now saying there. Just saying that people can then look to traditional herbs in order to be able to battle against COVID-19. But certainly concerns remain around just how much of a dosage they can take of these particular herbs and what's contained in some of these herbs. As Xolisani there says that they are, of course, trying to ensure that they look at some of these ways in order to be able to ensure that people do take the right kind of dosage, and even concerns there around getting access to the healthcare system. Some of the doctors who are also inundated, and they themselves cannot even afford to be able to get access to some of these hospitals should they fall ill. Certainly there is a situation that we'll be watching closely for you. That's Xolisani Ncube there, who reports for Newzroom Africa in Zimbabwe. Coming up, Buhle Madulini is standing by to tell you what's the latest in his world.